How you doing, guys? This is Dr. Suh at Specific Chiropractic, providing Gonstead Chiropractic, NYC. In this video, we're going to talk about what is cuboid syndrome, how you get it, and how we correct it. So if you like this video, please like, share this video, and subscribe to our channel for the latest videos. How's it going, guys? So we got a nice special guest over here. Clue us in. What can I do for you, sir?
Just going to get some adjustments on my foot, hopefully, and my hand.
All right, clue us in. What's going on with the left foot over there?
One day I was walking and I had some sharp pain and then felt a pop.
Point to me. Where do you feel that, sir?
Underneath the foot, but if I had to show you, it would be between these two or these three toes.
So between the fourth and the fifth over here?
Yes.
You got it. Okay. Anything else?
Then the hand, knuckle.
Yeah, cool. So what's going on with that knuckle over there?
I had banged it one day, and now during the winter time, when it gets cold, I can't flex. My hands lock up. So a lot of discomfort in the knuckle area. But right now, it's fairly good.
All right. All right. We'll take a look at that. And anything else?
The lower back, the right side. I guess from driving so much. Stiffness, traveling back and forth to Florida. Pain comes and goes. When I have the pain, I try to stretch, but that's just temporary.
All right, you got it. Let's take a closer look, see what's going on. All right, champ. Let's look for your normal temperatures. So right now, what we're doing is instrumentation. We're just looking for all these abnormal temperatures, given off from the inflammation itself. And right now, the rest of your spine looks pretty decent there. Okay, we got something here. There it is. Just to the left. All right. So let's see what's going on here. Because right now, you feel this muscle spasm here? Okay, your postural muscles on the left-hand side are very tight on this left side. Feel that?
I feel it.
Yeah, it's not as tight on the right side. Feel that difference there?
Yeah.
So clearly your body's trying to protect something going on here, but more so on this left-hand side. Not too bad?
There's a little stiffness.
Any tenderness or discomfort around this?
Slightly discomfort.
Slight. What about this fella here? Not too bad, huh?
Not too bad, no.
And now we're going to check for an Ist PI movement. How's that fella right there? Yeah, that's stuck. See, that's moving on the right side.
Yeah, the left side is worse.
Yeah, left side's not moving at all. We're going to check for IN and EX. Yeah, see, something's jammed over here too. See, the right side's moving just fine. Left side's not. Now let's check for the sacrum. There we go, something's jammed on the left-hand side. See, now something's moving too much on the right-hand side. Okay, right there, that's moving too much. That's stuck right there. All right. Okay, a lot of swelling and pullings on this left-hand side over here. Everything's all pulled around here. Let's check all the segments. How's that fella right there?
It's a little, that hurts.
That's tender right there, huh?
Yeah.
All right, so we got that 2S power right there. All right. Okay, champ. Now, as we see over here, we test and confirm on your sacrum. See this open gap like this? There's open wedge right there. That 2S, that's a problem. We tested your left ilium. Now that's, even though it may be fixated, but there's not really any swelling on that side. And it's all due to the fixation and misalignment of that 2S segment right there. So that's what we need to correct. Keep on. Just let it all sink in. Right there. And there it is. Coming up, sir. Walk around. Oh, man. Ooh.
Feel some pressure.
So say again, what's going on?
I feel pressure. When you press down,
Uh-huh.
I feel like it released some air. I feel like I'm mobile.
You're more mobile.
Yeah.
All right, that's good. Anything else?
Just I feel the press down. I still feel that, but that's about it.
All right, all right. What about your posture? How do you feel about your posture?
I feel like my back is straighter than before.
Good.
I don't feel like I'm slouched over, hanging over.
All right, that's a good sign.
I feel like my chest area is out. Not my chest, my abdomen is pushed out. Like I feel more. I feel like there's a stronger foundation.
Nice.
You know.
Any differences you notice right now in your left foot, sir?
Actually, yeah. Now that you bring it up, I don't feel like I was stepping on the ball as I mentioned earlier.
Oh, that's right. You mentioned that during a consultation.
Yes.
Can you tell the viewers again, what did you feel like before on that left foot?
It felt like my sock wasn't on correctly and I had to adjust it. But prior to the adjusting of the sock, it felt like I was stepping on a bunch of cotton material, i.e. the sock. If not, another example would be stepping on maybe like a bag of ketchup or a ball, like a small ball inside of my foot, a shoe rather.
Or a little pebble in there?
A pebble, yeah, perfect example, yeah.
Okay, so what does it feel like now? Since we corrected your low back, what's going on with the left foot?
It's definitely going down.
About how much?
Maybe like 40%, I'd say, if I had to put a number on it.
All right, how do you like that? We didn't even touch your foot
I know,
right?
I feel it. I feel the difference.
You want to know why?
Tell me.
All right. So this is what happened. The problem was there.
Okay.
Now, the most important organ in the human body is this fellow right here, the big kahuna, the brain. Now, we also have the motor cortex, which is right here. That's what controls everything in regards to movement, right? So that move your hands, arms, the legs, the feet, right? You got a little dance motion in there, right?
It was a signal.
So all that information, it needs to go down the spinal cord.
Okay.
And this is a two-way highway. Okay, it's not a one-way street. It's two ways. So all this information got to go all straight down to that foot over here, and everything got to go all straight up here as well. In addition to everything from this master computer here, he sent all the information to all the organs such as your lungs, your heart, stomach, the liver, bladder, so on and so forth, because these things don't run automatically.
No.
All right? As in other words, it needs the brain to tell it what to do.
Exactly.
In other words, we don't think about that, hey, wait a second, so give me a second, doc, I gotta breathe 24 times per minute, or have the heartbeat 74 times per minute.
Right.
We don't think about that. Everything controlled through this automatic, the brainstem right there. Right? So all that information needs to go to this super highway over here. And it needs to go like this all the time. But because you have this massive traffic jam over here, those all information that's going down this highway over here, this way over here, it's starting to get backed up over here. Mm-hmm. So how's that information? How are we expecting it to go down to that foot over there? As such, it's going to have trouble doing so.
Right.
So by correcting and adjusting this 2S over here, the second sacral segment, we start to clear up, and now we start to have more information just like this. Normal was supposed to flow like this, but it was being blocked like that. So now we start to have even more information going down to that foot. Mm. That's where you start to notice 40% more nerve function in that foot and more symptomatic relief, right? In addition to, I would not be surprised, you may experience some improvement for your sigmoid colon, okay, the bladder, and the sacral function over here, because that's the same nerve that all controls this region over here as well, right? So in the following visit, you'll let us know if you notice any particular improvement in either your bowel movements, your bladder, or everything else, so on and so forth, right?
Okay.
All right, let's get to the next part.
Wow. I really feel less discomfort on my left foot.
That's right. Say what?
I really feel less discomfort in the left foot as I just got up and walked over here. I usually come off of like my bed and I step down after a long night of trying to sleep, and I feel like I don't want to say it's pain, but it's like a numbing in the beginning, and then I guess the foot wakes up and it adjusts to the steps. But just now, as I got up, no problem.
Nice.
Yeah.
Okay, now let's start connecting even more dots. Let's get the other components of it for your left foot. Okay. So, this is your left foot x-ray. Now what I want to see is this talus over here. I want to see more alignment. This fellow over here is slightly tilted upwards. So this is our Ist talus over here. And on top of that, the arch over here is slightly collapsed, right? And that's due to this cuboid over here in the back, this region over here, is sunken down a bit. So in essence, what we're looking at is, even though it's a right foot model, you get the idea. This is this talus bone we're talking about.
Okay.
This bone, it went upwards like this.
Yes.
So I need to realign it down here. In addition to, this is that cuboid bone we're talking about. So whenever this fella comes out of alignment, all right, that's where, as you see, your fourth and fifth metatarsal bones are connected to this bone over here, to the cuboid.
Yep.
So if this is misaligned, it's gonna affect, like kinesthetic chain, like dominoes. It's gonna affect these two. So that's why you start to feel the pain. It says, okay, there's some kind of pain over here. What is going on over here, cuboid?
Now, is that because I played basketball as a kid, I've had a lot of sprained ankles. Is that a result of my foot popping up?
Yeah. So we see over here, this is the talus over here.
Yep.
So the most common sprain injuries, ankle sprain injuries, happens at the talus. So because this is our master keystone of the arch itself. Okay. This is our medial or the inside arch. So when this fellow goes out, the whole entire arches. It's supposed to have like arch like this, a little more arch. The problem is, just like here, right? So just like here, it starts collapsing like this.
Okay.
So when it collapses, right, this bone over here, everything else that's connected to it is going to start collapsing like dominoes. So as a result, the cuboid, which is connected to the outside arch, this will also start collapse. And then it's going to start affecting these like dominoes, right? So that's why we have to address the talus first, and then the cuboid, then I'll take a look what's going on over here.
Okay.
Let's roll. Yep. This talus is out. All right. Okay, just relax. We're going to pump it up first, and then we're going to set this bone. There you go. There it is.
Oh, that.
Yeah, good. Okay, so you do have this cuboid that's out. All right. Okay, sir, on your belly. Okay, so your cuboid, it collapsed, it went this direction. So now we're gonna realign this fella back where we gotta go. Once again, we're gonna pump it up before we set it. Let it go. There it is. Now we're just checking the metatarsals. No, those are fine. Okay, walk around, sir.
A little tender from all of the tugging, but I feel that little discomfort I was saying earlier. Maybe like 20% I still feel, but it's better than before.
So basic overall 80% better?
Yes.
Yeah, that's a great head start.
From the back adjustment to now with the foot, I wasn't able to walk barefooted like the way I am now. And I don't have any issue, any pain. Before I couldn't do this. So I feel a lot better.
Nice. So here's the strategy, because we just corrected that fella, all right? And because there's chronic edema and swelling into those joint spaces, because once again, the talus, that bone was misaligned. Your cuboid was also badly misaligned too. So there are surrounding swellings around that area. So what you want to do is get a bucket,
So,
fill it with cold tap water, okay, and 1 cup of Epsom salt.
okay.
Soak your foot in that for a good 30 minutes. Try to do that as much as you can for the next 2 weeks. Pump all that fluid out of there. All right, and you'll notice even more improvement that fella there.
I was also jogging with the issues. So does that add to the swelling?
Oh yeah,
Okay.
it'll definitely aggravate because again, remember you have to have an arch. So if the arches collapse, we're talking the inside arch and the outside arches. If they start collapsing, okay, and you're jogging on that collapsed arch, okay, it's going to keep aggravating it.
Right.
You need to have the springing actions on both sides of your feet. It was compromised. It wasn't working properly on yours. So that's why I was like slowly, steadily grinding it away in there.
Yeah, it feels a lot better.
All right. Wanted to do the final part? Let's hand?
Let's go.
Let's do it.
Let's do it.
So this is what I want to see. I want to see a nice rainbow arc. Okay. I don't see that with this bone here.
Yeah.
Yeah, this lunate bone, it's right. It's not following the pathway over here. So that's
drop down.
Yeah, so that's the fella that we did correct. And I wouldn't be surprised with what's going on because even this fifth metacarpal head over here is slightly misaligned, like it's slightly rotated.
Yeah.
It's like rotated like a little bit towards this way, a little bit.
How about the fingers, the other 4?
Well, it's
I think they're all crooked, but that's
this
basketball.
one's slightly misaligned, so is this one. But most of it,
this
the dominant effect is from here. So let's take a closer look, see what's going on in there. So first things first, we rule out the elbow. That's fine. Okay, relax this. Okay, that's moving fine. That's moving fine. This lunate, see that? Feel this? I can't deviate this way.
And it clicks.
Ulnar deviation.
I feel it click too.
Clicking too, right?
Yeah.
Crepitus. See, I could rotate this way. See, I could deviate and tilt this way. It doesn't move this way. See how your thumb is. See, even this is locked up. That's not moving right either. Yeah, see, your metacarpal. This is not moving too well. Yeah, everything's all from this lunate here. I'm gonna fix this lunate. Pump it up first before we set it. Okay, relax this a little more. Just a little more. There it is.
Oh yeah.
Oh yeah. There's a big corner right there. Let's get this done. Just relax this. Just relax. There it is.
I got too comfortable in that one. I almost fell on you.
Okay, sir, lean back.
Okay.
Just set this over here. There it is. Okay, give it a try.
It's better. I don't have any discomfort when I make a fist. Even when I squeeze tight, this area, this region would hurt. No. It's better. A lot better.
I like that, champ.
I love it.
Well, there you go, brother.
I don't want to mess it up too much.
All right, champ. We're all set.
Appreciate you, Doc.
Hey, not a problem.
Thank you so much.
You're welcome. Have a good one.
Appreciate it.
So, give us the latest updates. How's everything holding up?
Everything is better than the week prior. Before I had pain, discomfort as I was walking. And then you worked your magic, readjusted, started with the lower back. From that point on, the pain level dropped 80%. At that time, a week ago, as per right now, I have no pain, no discomfort. As I mentioned before, I had like a cotton ball feeling. Just me now, just being conscious, I'm walking very gingerly because I don't want to hurt myself, obviously. I know I'm still in the healing process, so I'm taking my time, but overall, no pain in the foot.
Nice, nice. So basically, let's take a look down here. Both your feet, sir. Yeah, we can see that. It's still not bulging as much, but it's still bulging a little bit on that side over there. All right, so looks like we still got a little work to do. We'll take a look, see how that's holding up. Have a seat, sir. Okay, it's not too bad. Take a look at it. Hey, this is not bad at all. It's healing. Great job. So what I want you to do is this. I want you to continue icing this fellow over here. All right, champ. Let's go ahead. Let's take a look at your feet. Okay. Oh, this is doing better. Good. So you still have that cuboid syndrome going on. It's cuboid's out. But this talus is doing better. Good. Flip over, sir. Feel that fella right there?
Yeah.
Yeah, that cuboid's still jammed. Still inferior. So we're going to pump it up before we set it. There you go.
Yeah.
There's a biggie. All right, walk around, sir.
Better. Felt like I was leaning on something. Like as I walk, I felt pressure on the left side. But I don't feel that discomfort anymore.
Nice. Yeah, we have to keep on working on that cuboid a couple times. But the more important thing as well is also make sure your foundation, right, that sacrum, what we corrected the last visit,
Okay.
you keep on icing that fellow. So, because all that swelling is pitching off that nerve, is not allowing the ligaments for that cuboid to hold in place. That's why, since you're still walking on it, right, it's going to knock right back out again.
So keep icing.
Yeah, keep icing the low back. How's the hand doing, by the way?
It's better, despite the cold. It hurts in the cold, but as of right now, it's good.
All right, let's take a look at it. Can you just relax this over here? Okay, just lunate slightly out. And how is this doing?
That's where the pain is.
All right. Let's get this lunate a little more in there. Yeah, it's a little popping in there. Just relax a little more. A little more. Just there we go. Just relax the elbow. Just relax. There's the rest. Good. All right. Just lean back, sir. Just lean back a little more. Let it go.
Oh.
It's a little tricky. You gotta get a little more out of it. Let it go. There it is. All right, champ. Give it a whirl. See how I like it.
It's not as painful when I squeeze tight. Definitely has eased up from before. Feels a lot better.
How much better would you say?
Last week I was at 100 as far as the pain goes. Right now, I don't feel any pain, to be honest.
Hey, that's great.
But let's see what the cold weather brings me, because my bones always hurt in the cold.
I hear that.
Primarily this region, but it's fine right now. It's beautiful.
Oh, you're loving it, brother.
I love it.
Yeah, that's great. All right, well, we'll continue our progress. We'll keep on working on that cuboid, all right? To maintain that cuboid syndrome, keep that at bay. And also, we'll keep working on that hand as well. All right?
Perfect. Thank you so much.
Hey, not a problem.
Thanks,
Take it easy.
You too. Thanks.